Welcome back to Technique Tuesday. My name is Dr. Nick with Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. Today I'm going to show you 2 moves to measure how good your hip mobility is. The first one that we're going to do is we're going to test how good your adduction is. Adduction is when we bring the leg in. So the hip moves in all kinds of planes. We want to see how well your ability to move or strength is to move your leg inward. This helps mitigate or calm down all kinds of irritation we get with gluteal tendinopathy, with hip bursitis, this kind of hip pain on the outside. So we're going to measure how good it is. And here's how you do it. Start with your feet kind of inside your shoulders or inside your hip width. Stay big and tall, and I want you to reach, to kind of squeeze down and pinch your knees together. If you can touch at that spot with your feet there, move your feet out a little bit wider. Get outside your hip width and then squeeze the knees together again. Keep going until you can't squeeze those knees together and touch, and see how far down you can go. If you have a hard time at the first level, which is inside of hip width, we know we got some hip restrictions and we need some mobility work. If we can get outside into level 2, where they're just outside of our hips, and we have a hard time with that, then we can work on strength and mobility issues. Beyond that, you're doing pretty good. Keep it up. The next one that we're going to talk about is internal rotation. Internal rotation of the hip is where our femur bone, this is our big leg bone here, is rotating inward. As we rotate that inward, you're going to see the leg kick out. This is hugely important when we walk. Everyday moves, we have to have some internal rotation, because when we walk, we have to be able to pivot our pelvis on our femur, and that happens with internal rotation. Hugely important, and one that often gets stiff. In fact, it's one of the ones that we measure all the time to see who has really bad hip arthritis, is because their internal rotation is nearly 0. So this measure is hugely important. We set it up by doing it against gravity to see how much strength we have with the internal rotators as well. This is a yoga block, this could be a pillow, it could even be a small soccer ball. Put it between your knees, squeeze it between your knees. We're sitting upright, big and tall, 90 degrees at the hips and 90 degrees at the knees. And we're going to push our legs out to the side and squeeze the block. We should be able to get to 30 to 45 degrees of motion to the side and without pain in your hips. If you notice that one is different than the other, one's more stiff or limited, or one's really hard to do, maybe it starts to spasm or want to feel like it's cramping up, then we know we have some work to do with internal rotation. We see a lot of folks who will get here and they can barely move their feet out to the side. This is an easy, quick measure to say, okay, do I need to work on some mobility for my hips so I can walk easier, get up and down from a chair easier, and hopefully avoid hip replacement in the future. Especially if you're in your 50s and 60s and are having a really hard time with this move, get some help on that really quickly, because that's going to help you stay away from your hip bursitis, your hip replacements, and eventual long-term difficulty. I hope those 2 moves help. We went over how to know if you have any difficulty with adduction or bringing the leg in, as well as internal rotation, bringing the ankle up, but also pivoting our pelvis around a fixed leg. Both of those hugely important in maintaining good joint health and mobility. If you have any questions, feel free to check us out on YouTube, where we have a channel dedicated to all kinds of health tips, especially helpful for those 40 plus who are looking to stay active and avoid surgery, pills, or injections. Have a great day.